Welcome to Insurance Talk. My name is Cherie Martinen and I am the owner of Bancorp Insurance. We are a locally owned, family-run, independent insurance agency located in Lapine, Oregon. And today I have a very special guest on our podcast. Her name is Emily Carrick and she is the PacificSource Medicare Advantage marketing representative or executive. She's probably an executive. And I'm so excited to have her here today because we are learning about PacificSource's 2023 Medicare Advantage plans and what they're offering.
Well, thanks so much for having me, Cherie. I really appreciate the opportunity. Many of you listening may already be PacificSource members, so thank you for your membership. But if not, we have a brand new plan coming in January that I'm really excited to tell you about. It will be our first ever zero premium Medicare Advantage plan that includes Part D prescription drug coverage.
I am so excited about this. PacificSource has been a staple in our community for years, and we've trusted them and sold their policies. This makes it even better because how can you get all of these great services for $0?
Yep, and that actually is a really good question that we do get asked. How can it be zero monthly premium? Well, just keep in mind all of the Medicare Advantage plans do receive funding from Medicare because really we are doing all of the different services, taking care of members, paying the claims and whatnot. So in some circumstances, the funding we receive from Medicare is enough to cover all the benefits on the plan.
And you guys, this is a good plan. Don't think, oh, I'm paying $0, so I'm not getting anything. No, this is a good plan.
This is a really good plan, and the most exciting part about it, besides zero monthly premium, is the dental benefits that you're going to get included in the plan. You're going to get 3 cleanings per year. We have never been able to offer that before. 3 cleanings per year as part of the plan. You can see any dentist you want, so you don't have to stay in our dental network. And it also covers 2 dental exams per year, the full mouth Panorex x-ray every 5 years, and the bite wing x-rays. So it is a great plan. It also has up to $1,500 dental benefit per year, which you could use for preventive care or comprehensive dental benefits or a combination thereof.
You guys, normally we have to upsell somebody to get such a good dental plan included in their Medicare Advantage plan. But this is right on the exact same plan for that $0. This is a great benefit.
Yeah, this is really unprecedented. We have never been able to offer anything like this before. But you know what? We hear you all loud and clear. Our members tell us we want more dental benefits. So we heard you, and we were able to get that done this year.
They also have the vision. That's been there before, but it's good that we have it.
It is, and we're making some improvements to the vision benefit. We're getting rid of the copay for your routine vision exam, which is when you're reading the eye chart. And we still have our benefit for eyeglasses. It varies by plan, but on this zero premium plan, it's $250 every 2 years. And it's a reimbursement benefit, which means you can go anywhere that you like to buy your glasses, and we will reimburse you.
And then we still have hearing, because that's another one. Right, if you can't hear, eat, or see, then what's the point?
Right, I just realized I gave the wrong amount for eyeglasses.
That's okay.
It's a $200 reimbursement every 2 years for eyeglasses. And yes, the hearing is also very important. We do have a hearing aid benefit that's included in all of our plans, where you can buy a high quality hearing aid as low as $599 per hearing aid. And that includes a year's worth of adjustments, unlimited adjustments, a year's worth of batteries. So you may have heard they're going to start selling hearing aids over the counter, but we've been cautioned by doctors who test people for hearing that they may not be adequate because really they're not going to be individualized to that person's needs.
No, that's good to know. All right, so we did dental, vision, hearing. I think those are like the big 3, but you guys also have a lot more.
We do. A couple others that I'm really excited about, one of which is new for next year. Our members will be sent a catalog and they can order by mail any item that qualifies as an OTC or over-the-counter item. And on this zero premium plan, you'll be able to spend up to $25 every quarter, so potentially $100 per year, for things you're probably buying at the grocery store anyway. Band-Aids and toothpaste and toothbrushes, things like that. So it's a savings.
I even think of like a multivitamin.
Yes,
Yeah.
vitamins, Tylenol, I mean anything that you might need. So that'll be a really great benefit, super easy to use. You can just circle what you want in the catalog, give them a call, they ship it out second day air. So you'll get it very fast.
What else do we got going on? Well, you still have the Silver and Fit.
We still have
That
Silver
one's
and
still
Fit.
popular.
Yeah, and if you are the kind of person that doesn't want to go to a gym, there is a home fitness program option where you can ask for a free Fitbit and they'll send that to you.
Oh,
Yeah,
that's fun. You can track your steps.
that is fun. Yeah, exactly.
What else do we got? Telehealth is really common this year.
Yeah.
I've been seeing it on a lot of plans, including all of yours. Obviously, I think this became really popular during the pandemic, and I think it's here to stay. We like being able just to call people from our phone and get an answer and not make an appointment and sit in a waiting room and then see the doctor and then get an answer.
And maybe get exposed to more germs.
We don't know, maybe.
I really like doing the telehealth personally. I just call them from my iPhone. They can see me, I can see them. It's great. Another one I wanted to be sure to mention, and this is just a benefit that's continuing next year, and it'll be on all of our plans, is one that we call Rewards for Healthy Actions. I like to call it the gift card program, because if you are doing a preventive screening that's covered under this benefit, you can earn a gift card to over 100 different stores. So just for example, if you're getting an annual physical or the Medicare annual wellness visit, either of those will earn you a $50 gift card. And you don't have to remember to ask us for it. We're going to reach out to you and let you know you've earned it, and you just tell us what company or store you want it from.
And I like that one. That one's just an easy way to get fun stuff. Because if you're taking care of yourself anyway and then you get a gift card in the mail, not bad at all.
For sure. And I have to say, from the insurance company side, it is money well spent, because as I'm sure all of you know, if we catch something early, it's much better for your health. It's much less expensive for everybody. So we are happy to continue on with this program, and we've had great feedback from our members about it. Some other things that you can do, these are all free preventive screenings covered by all of our plans. You can earn a $25 gift card if you get a mammogram. If you're diabetic, you get a free diabetic eye exam every year. And not only is it free, but you'll get a $25 gift card for getting that done.
So you're getting paid to check your eyes.
Pretty much. There's rewards for A1C tests, $10 for getting your flu shot, which I know a lot of our members are great about doing anyway, $20 for a DEXA bone density scan, and there's a colon cancer screening reward for $20 that you can earn either by going in for a traditional colonoscopy or by calling our office and requesting a free at-home colon cancer screening kit. So I'd really encourage you to do one or the other at least to get that screening done, and you'll get a $20 gift card.
All right, I'm going to mention this one too because I think it's really popular, the alternative care. That's like the chiropractic, acupuncture.
Yes, so all of our plans include a benefit for alternative care, which means you can see a naturopathic doctor, which normally would not be covered under Medicare. So if you have Medicare and a Medicare supplement, you don't have access to that. So that would be something unique to our plan. Also, you can get any kind of chiropractic care or any kind of acupuncture that you may need. And on this new plan, the zero premium plan, you'll be able to go to any alternative care practitioner that you like. They do not have to be in our network, which is a change from previously. And you'll pay a $25 copay for each visit, and you can do up to 12 visits per year, any combination of those services.
Yeah, you guys, this is again on all of their plans, but including that $0 plan that's coming out this year. So if you are on PacificSource, one of the things we wanted to mention was if you're already with PacificSource and then you're interested in the $0 plan, you do have to take some action.
Yes, you do need to complete a new enrollment form, and I know members always ask, well, why do you need me to put down my address and phone? You have all that, and that is true, we have all that. But what we find is sometimes we don't always have the most up-to-date information, so it just helps us take care of you better if we get that information fresh every time you change your plans, so we make sure that we have the best contact for you. And along those lines, I wanted to mention a couple other plans. I know we have a lot of members on our plan, the Essentials Choice RX14 plan. We're making a really positive change to that plan. It will be $95 a month, so a little bit drop in the premium. We're getting rid of the out-of-network benefit limit. That is the big deal. Currently, of course, if you have an urgent need or an emergency anywhere on earth, we cover that as if you're in the network. So out of network, I recommend people think of scheduling care with a provider out of the network. So currently, there's a $2,500 limit on how much we would pay on what we can cover for scheduled out-of-network care. That's going away next year. Also, we're adding that full out-of-network benefit to the Essentials 2 plan. If any of you have VA benefits, that is a fantastic plan to be on. There's no monthly premium. It does not include Part D drug coverage. However, you probably are using the VA for that. And that plan is going to have so many bells and whistles added that if you are a veteran and you're looking to have more options to go outside the VA system if needed, this plan, I'll just mention one or two of them. The Essentials 2 plan will have $150 per quarter that you can spend on the over-the-counter catalog items. Also, it's got the dental included in it, the 3 cleanings, and this one has up to $2,000 of benefit included.
That's so much. Normally we don't see that. So it's really special that you guys did that specifically for this more focused towards VA individuals.
For sure. So next year we'll have 2 zero premium plans, one with Part D drug coverage included and one without for those who don't need drug coverage or don't want it. So those will probably be our most popular plans, quite frankly, because there's no premium.
But you're still getting all of these amazing benefits with both plans, and you get the amazing doctor network that's here in Central Oregon as well.
You do, and I think one of the things PacificSource has been known for is having a very broad provider network. So we have just about everybody in our network. It's a very big network, and just as a reminder, our PacificSource members can also get care up in many Portland area facilities like OHSU, Legacy Hospital System. There's all kinds of clinics. So when we talk about our provider network, it's not always just in our hometown here in La Pine or here in Central Oregon. It does go far beyond that. And again, if you're on vacation, you're visiting family, you get sick and you get admitted to the hospital, we consider you in network because you were admitted due to an emergency. So just keep that in mind. The network is just applicable to scheduled care.
What else? You guys have even more, I know.
We do. There is a lot going on. Again, we know we're going to get a lot of attention this year with the brand new plan. If you're not already working with Bancorp Insurance, you should give them a call because they can help you either make the transition onto that plan if you're one of our current members and you would like to do that, or if you've never looked at PacificSource before, they are a great resource. And we've worked with Bancorp for many, many years and just appreciate the service they provide to this community.
Well, thanks, Emily.
Sure, you're welcome. It's the truth.
Oh. We also, again, we love helping people with their Medicare. If you have any questions about Medicare, you can schedule an appointment, have a one-on-one sit down with someone. You can talk to someone over the phone. We also do those Zoom calls and things like that, but I think the most popular is over the phone and in person. We're taking appointments right now.
I bet.
So really you can't do anything until October 15th, but October 15th to December 7th, we're signing people up. We think PacificSource is going to be a great choice this year. We have a feeling that a lot of you will too. Hopefully when you listen to this podcast, you get excited You go to our website at www.bancorpinsurance.com, hit the big button in the middle that says make an appointment, and get on the calendar because it is going to be a busy open enrollment.
Yeah, that's great that you make it easy to make an appointment because you really do want to set aside time for each person. Probably everybody listening has a little bit different situation, different list of medications. Maybe you know, if you're new to us, you want to make sure they're covered by the plan. We have a very broad formulary, which is a list of medications that are covered. And along those lines, there's a couple things I did want to mention about our prescription benefits. We have a select group of medications that are prescribed for blood pressure, cholesterol, diabetes, and osteoporosis that are free to our members. And you can get them through any of the pharmacies in our network or through our mail order, and they will be free to you. And you know, that's a deliberate decision by our pharmacy team. They realize that we don't want someone to stop taking these medications, and these are ones where we realize they might not feel any different if they stop taking them, but they might be putting themselves in harm's way at greater risk of a stroke or a heart attack. So that was a very intentional decision to make sure cost would never be a barrier for these medications. And we also offer a great home delivery system for medications. We use CVS Caremark for our mail order service, and you can save even more money on the other medications that we cover by getting them through CVS Caremark mail order. I do that myself for medications I take. I've been using them for years, and I like to say the hardest part is getting mail orders set up, but our customer service team can help you with that. So just give us a call. Once it's set up, it'll work great. I love not having to be person number 20 in line at the pharmacy. I don't know about you guys, but that's not the most fun thing to do. I'd rather just go to my mailbox.
You know, if you have to drive to the pharmacy too, it's just so much easier to go to the mailbox and not have to worry about it. Plus, you're not doing that thing where you're like, did I call it in? I don't know if I called it in. Did I call all of them in? Maybe just I called that one in.
Is it ready yet?
Is it ready yet?
That's the big one.
Yeah.
You called it in a week ago. We're still working. I know. It's tough.
So I also love the mail order, and I know we have quite a few people that have signed up and they love it as well.
Great. That is great to hear. There are many brand name medications that you can get a 3-month supply for the cost of just a 2-month supply, but only by using the mail order. So if you are taking medications and you're looking for a way to lower your costs, think mail order. That may help a lot.
All right. There's more. There's more.
I'm sure there's more. I would like to talk just a little bit about some things that make our organization different.
Yes.
I actually just last month celebrated my 17th year in this position, and I just love being a part of PacificSource. I like to tell people we are a not-for-profit, so that means we're not in this for the money. We're not trying to get our CEO a Learjet or anything like that. In fact, most years we do lower our premiums whenever possible. We want to give that back to our members. We also do a lot to participate in the local communities we serve. Our employees have driven a Meals on Wheels route every Monday in Bend for the last, I think, 22 years. And I was part of that route for about 15 years. And then COVID hit and other things had to take priority. But and we actually, as an employee, we are encouraged to use our paid volunteer time hours that they give us and go out and volunteer in the community. So there's just a real spirit of giving back that just resonates with me personally. And I just can't say enough about PacificSource and all the good things that we do for the community and our members.
One of the other nice things about PacificSource is they do have an office right here in Bend. It's over by the hospital, so it's not that far away from a lot of providers that a lot of us see. So if you did have a really big question or couldn't figure out something, chances are you could make an office appointment.
Yes, and I will caution you, we have struggled, like you've seen so many other businesses, to hire enough people. Every business I walk in now has hiring, inquire within, so we are trying to do our very best to get to everybody quickly, but we do want to continue to provide that high quality customer service. And when you call our office during regular business hours, You're not going to have to go through a phone tree and press 1 for this, and 2 for that, 3 for that. You're going to get a real person in our Bend office that answers your call and asks you what you need and gets you to the right place.
And if it's not even in the Bend office, most of your guys' call center support is also located in Oregon, right?
So we have on our Medicare customer service team, it is split actually between Boise and Bend. So you're either going to get someone in Boise, Idaho, who knows our plans inside and out, just like the Bend folks, or someone right in our office in Bend. And the address, if you're curious, is 2965 Northeast Connors Avenue.
All right. What else about the PacificSource? Again, I'm so happy to have them here. You guys, if you haven't checked them out before, it's a good time to check them out between October 15th and December 7th. You can visit our office in La Pine, Oregon to learn more about PacificSource. Gosh, is there any other benefits we want to tell them about?
There are so many. What did we miss? Talked about the eyeglasses. You know, one thing I do want to point out, if you're new to Medicare, you're just starting Medicare, you get one full physical covered for you. They call it your Welcome to Medicare physical. And then every year thereafter, you only get the Medicare annual wellness visit, which can still be beneficial, but it's different. It's not a hands-on physical. So all of our members have access to continue receiving a full hands-on routine physical every year if you want. And that's in addition to the Medicare annual wellness visit. So I just let people know when you schedule your appointment, you want to be really clear with what you're coming in for. So if you do want an annual routine physical, I would be sure and use those words. And there's no charge for that, and that's an extra benefit for our members.
Awesome. I know I always tell people, I'm like, okay, you got a $0 plan, now you have no excuse, go get your physical.
That's right.
Because it's not going to cost you anything to go either.
That's right. Got to catch things early, and I know sometimes I'll hear people say, I'm proud to say I haven't been to the doctor in 10 years, and I'm like, oh boy. It might be a good idea to go.
Yeah, let's get a checkup.
And then you're established as well. You know, we do hear sometimes that it's hard to quote unquote find a doctor. So if you do find a doctor you like, you usually need to see them about every 1 to 2 years to stay active in their practice. So that's just another tip I'll pass along.
What about like mother's meals, you guys?
So we have a meals program. It's called Meals as Medicine.
Ah, shoot.
That's okay. And so if you are discharged from a hospital admission, so you've been in the hospital, or if you're being discharged from a skilled nursing facility, like a rehab facility, you are eligible to receive a box of healthy frozen meals that are tailored to your discharge instructions from your provider. And you don't have to remember to call us and ask for it. We will reach out to you and check in on you, see how you're doing. We'll review any questions you may have about your discharge instructions, and then ask when you'd like to start your meal delivery.
Awesome.
Yeah.
And the travel one too, the travel benefit?
Yes, we have a program called Assist America. You only have to be 100 miles from your primary residence to use it. So in Central Oregon, that means we only have to go as far as Salem. If we have a medical issue, or maybe we forget our prescriptions at home, we can call Assist America. They will either facilitate transferring your prescription over, or they'll FedEx your medications. So you can use it in the United States, or if you're traveling overseas, you can use it there as well. Any medical need that may come up. We had one recently actually where some translation services were needed. So they offer medical translation, all kinds of things they can help with. And it's free. And just call PacificSource and we'll get your call transferred over to them if you need that service.
Awesome.
Yeah. So there's a lot to look forward to. We're very excited.
2023 is going to be a really good year for PacificSource. If you are interested in any of their plans, like we said, we think the $2 $0 ones are going to be hot.
They are. I do like to reassure our current members, though, if you're happy with your plan, you don't need to do anything. You don't need to re-enroll each year. So you can just sit tight. I'm sure by now you have received your packet of information letting you know about any changes. Overwhelmingly, the changes are positive next year, so it's good news.
All right, Emily, if there's nothing else, I'll say thank you for coming. We are so happy again to be representing PacificSource in 2023 for their Medicare Advantage plans. If you are interested in switching to that $0 plan, or you want to look at PacificSource just as an option, you can give Bancorp Insurance a call at 800-452-6826. You can visit us online at www.bancorpinsurance.com and make that appointment for October 15th through December 7th for that annual election period. That's when you can make all of those switches or changes or look at all of the new plans coming for 2023. So thank you so much, Emily, for being here.
Yes, thanks for having me. I appreciate it.
And I look forward to seeing you later in this annual enrollment period.
Thanks so much.